away on April the 25th. So again, that's bringing our total count people testing positively to 3,419, and then our death count is increasing to 50. Let me also say that we are looking at opening another mobile testing site tomorrow in the Sunnyside area, and that will take place at Wortham High School. So we'll be opening up another mobile testing site on tomorrow, and I would say right around noon at Wortham High School. Let me pause and let me bring up Dr. Peirce. Dr. Peirce.
Thank you, Mayor. Mayor reported the numbers, which included 4 unfortunate deaths, an additional 4. And I want to share with you a story, a brief story. A colleague of mine, not somebody I know, but another emergency physician in New York State, Dr. Lorna Breen, on Sunday took her own life. Dr. Breen was working in the epicenter in New York City, where all these cases that we've seen on the news. She contracted COVID disease and had to go home and isolate herself at home. And she recovered and got better and actually returned to work. But the emotional strain apparently was too much for her. And after being at work for a short period of time, her family took her to the family home in Virginia, where on Sunday she took her life. Her father reported that she had been detached and depressed. And I just want to point out to folks that as we move forward, all of us need to understand the burden of this disease on those who contract it and those who are working in our hospitals, our firefighters, the police officers. We in Houston are really, really fortunate that we started early. Today's additional 4 are tragic. But this is the 4th largest city in the nation. And our numbers are nowhere as close to what our friends and family as Americans, fellow Americans in New York City have suffered. We are tremendously fortunate to be this far ahead of the curve, if you will. So as we move forward, we need to make sure that we are moving forward and not moving backward. Because my fear is that if we move backward, we will wind up in the situation that New York is. Now, I don't want to be too gloomy about it. We are in a great position to move forward, but we need to do it intelligently. We need to pay attention. And so as the governor has made his decision and things are going to be changing, that doesn't mean that we can drop our guard. The mayor and the judge locally acted early, acted quick, acted decisively, and we are all the benefactors of those actions. But as we move forward, let us not forget how fortunate we have been in this community. Let us honor the lives of those who have been lost, both locally and nationally, by behaving responsibly, wearing our masks, social distancing, covering our coughs, employers being intelligent about how you open your businesses, employers be intelligent about how you manage your employees. Media, be responsible in your reporting and how you help us educate the public so that we can best protect ourselves. This disease, while our numbers of death is small, our numbers of ill is not. Chief Acevedo and Chief Pena have related to you personal stories of our employees who have wound up in the intensive care unit. And we've been hearing day after day about our homicide detective who has remained in the intensive care unit. We've heard day after day about our firefighter captain who is in the intensive care unit. This disease can be devastating if we give it a chance, but we are in control of that destiny. Wear your masks, social distance, wash your hands, take control of your future. Thank you, Mayor.
And so please bear in mind that this virus is still prevalent in our community, and as and the numbers are low because we've acted and we've been very careful about staying home or working safe in our essential businesses, wearing the face coverings and social distancing. And so let me just say, as the conversation in large part starts talking about opening up, let me just say for myself, I'm going to continue to be very, very cautious. And I would encourage people to be very, very cautious. And reality is, just because something opens up doesn't necessarily mean you have to go in there. And so that's what I'm saying to my family members, and what I say to my family members, I'm saying to the people in this city. Be very, very cautious as you move forward. because as long as we're reporting new cases, and as long as we're reporting people who are dying, and as long as we can't tell you that this virus is out of here, then you need to be very, very, very careful. Please take advantage of the testing sites. Again, Butler Stadium, Del Mar Stadium, Barnett Stadium, and then the other mobile sites that are opening up throughout the city. And whether you're symptomatic or asymptomatic, everyone, documented and undocumented, everyone is invited to be tested for this virus. Before we talk more about the COVID-19 homeless initiative happening here at Fundy, I want to acknowledge a very good friend and someone who's just representing us extremely well in Austin, State Representative Christina Morales, who has donated a mask to the Houston Fire and Houston Police Department, and also I just think this past Sunday had her own drive at the family business. Whereas in the beginning of the year, she passes out school supplies, but on Sunday she was passing out masks to people in the community as well. Let me bring up State Representative Christina Morales.
Thank you so much, Mayor Turner. It was actually at Houston Community College, the Southeast campus, that our wonderful fire chief came and helped us. But I want to thank you for all you do, and our County Judge, Lena Hidalgo, to keep our citizens safe. And again, thank you to Chief Peña for helping us distribute 7,500 masks on Sunday at Houston Community College, the Southeast campus. I'm State Representative Christina Morales, but today I'm here as president of the Felix and Angela Morales Memorial Foundation and also as a concerned citizen. By donating the KN95 mask to the brave men and women of the Houston Fire Department, we are living up to our mission, the mission of our foundation, which was to give back to the community. This gift also demonstrates how together, as elected officials, business and civic leaders, and compassionate human beings, we can win the battle against COVID-19 infections. Our firefighters and emergency medical technicians face many challenges as they seek to protect and serve us daily. For their valiant efforts, the Morales Foundation is very proud and honored to be able to do our part to keep the members of the Houston Fire Department and the Police Department healthy and safe. And very quickly in Spanish, gracias, Alcalde Turner, por todo lo que hace para mantener segura nuestra ciudad. Soy la representante estatal Cristina Morales. Estoy aquí hoy como directora de la Fundación Félix y Angela Morales. Por sus esfuerzos valiosos, la Fundación Morales está orgullosa y honrada de hacer nuestra parte para mantener los miembros del Departamento de Bomberos de Houston saludables y seguros. Gracias. Thank you so much.
Thank you very much. Thank you very much. And even though there's no penalty associated with wearing masks or face covering, people really want them because they want to protect themselves. I think Councilmember Pollard had his event. Can you tell us just briefly how that went and the response?
Sure. So this morning we had a mass distribution at the Plaza Americas Mall, which is located at 7500 Bel Air Boulevard. Well, we were able to provide 15,000 masks. The event was scheduled to start at 10 a.m., but the first car started lining up at 6:30 a.m. And so people are truly in need of masks. They truly want to comply with the order. And we know that minority communities have been affected more so than others. And District J, which I represent, is heavily black and brown. And so it was good to see people to come out, receive their masks, and we do what we can to keep our community safe. Thank you.
Chief Peña, any update from you?
Thank you, Mayor. Oh, okay, yes, sir. Good afternoon. Thank you, Mayor. I want to first thank Ms. and State Representative Ms. Cristina Morales and the Felix and Angela Morales Foundation for the incredible, generous donation of over 1,200 masks. I don't know if you mentioned that, but it was over 1,200 KN95 masks for the Houston Fire Department and the Houston Police Department, which we'll gladly share with our partners in blue. Thank you for that donation. And before I begin my report, I also want to publicly acknowledge the incredible work that the Firefighter Foundation of Houston has done to attain donations for the Houston Fire Department and first responders. The Firefighter Foundation of Houston, along with Reliant, have donated about $1,000 that goes directly for the purchase of food for those first responders that are in quarantine. So appreciate the generosity on their behalf. In addition to that, Apache Corporation has donated $60,000 for the purchase of personal protective equipment kits for first responders, firefighters and first responders, to ensure that they have the equipment available to them as they approach these scenes. Chevron has donated $10,000 in gas cards that we're using for our firefighters and their families who are in the hospital either due to COVID-19 or cancer. So that truly goes a long way to ensure that it eases the financial burden on these families. And finally, Exxon has also donated $10,000 that is going for decontamination equipment that we're using to ensure that we're providing deep cleaning for our fire stations. And all these efforts from all these different donations and generous contributions are helping us go a long way to ensuring the safety and the health of our firefighters, first responders, police officers, and those that are on the front line of combating this virus. So real quick, but I don't have much change in regards to our numbers. We have 68 firefighters in quarantine. We've essentially maintained that level for the last couple of weeks, which is a positive trend. We hope to keep it that way, and actually we're seeing some lowering of those numbers. We have 40 firefighters that have tested positive in the course of this operation for COVID-19. The majority of those have come back. About 26 of those have come back to this point, and the remainder are recovering safely at home. So that's my report, Mayor. Thank you.
Chief Husband. Okay. Chad.
Thank you, Mayor, Council Member, and State Representative. Thank you for your leadership and for your support of our first responders in the community. And our situation is still the same as yesterday. Don't have much of a change, but I do want to once again point out that when people are lining up at 6:30 in the morning for mass distribution starts at 10 o'clock in the morning, it means that there's a lot of our fellow Houstonians that are worried about their health, worried about their long-term health, and they're worried about this virus. And yesterday, Mayor, as you recall, we made it real clear that businesses, regardless of what the law says, have the right to not let people in without a mask. And for some reason, all we're trying to do is educate the public, just like we're looking at an education piece with the ordinance that had been passed by the county, the order from the judge. Let me make real clear, we're not interested in going around being the mask police, but the community needs to understand that if a business requires a mask to come in, just like no shoes, no shirt, no service, that is their prerogative. And the point we're trying to do is educate folks so we don't turn it into a police matter. We've got plenty of issues to deal with. And so the point of that statement yesterday, again, is to educate folks so we don't have to be using up our very limited resources coming to businesses. So that's about it, Mayor, and I appreciate you giving me the opportunity to speak.
Thank you very much. Now I want to turn to the reason why we are here at Fundy Recreation Center. And it's a place where athletes normally would attend. But on a normal day, our homeless brothers and sisters who nearly all suffer with chronic underlying health conditions are some of our most vulnerable at-risk individuals in Houston. And that vulnerability is only compounded during a pandemic, as our homeless either do not have easy access to hand hygiene like running water, or live in dense shelters where it is difficult to practice social distancing. To literally prevent people from dying on our streets and our shelters, the city worked quickly, engaging the CDC and HUD, local partners, and cities around the world to create and implement a comprehensive three-pronged response around three key areas: prevention, emergency response, and recovery. Prevention, emergency response, and recovery. And before I go any further, I do want to acknowledge this young gentleman here, Mark Eichenbaum. Mark is the Mayor's Special Assistant on Homelessness, who has just done an incredible job and has an incredible passion for assisting people who are homeless. And I do want to acknowledge and give him the credit in terms of representing the city and myself on this initiative. So thank you, Mark Eichenbaum. Mark is just a little bit younger than I am. We're about the same age. With regards to the three prongs, prevention, emergency response, and recovery. On prevention, 10 area outreach teams continue to distribute vital information and supplies to our unsheltered population while screening those on the streets for symptoms. Along with the county and the downtown management district, we have placed more than 20 hand washing stations in the area with the highest concentration of homeless individuals. We have also distributed to homeless agencies and homeless individuals more than 8,800 face masks, 6,500 bottles of hand sanitizer, and 15,000 antiseptic wipes. Furthermore, in just 2 days, we repurposed funding into an ancillary shelter, enabling our largest shelters to decompress and fully implement social distancing. When we looked for an operator for this shelter, there were not many who were interested in this task, I will tell you. But the Salvation Army, under the leadership of Major Bell and Board Chair Joe Clary, were not just interested, but they were eager to help. So let me just say from the very beginning, Major Bell, thank you. To the chairman, Joe, thank you so very much. Please, give it up to the Salvation Army. And I see the Mayor Pro Tem is here, Dave Martin, But I do want to just really applaud the Salvation Army because they have really stepped up. Practically overnight, the Salvation Army created intake and screening processes, assembled supplies and food services, and devised the operational and logistical plans to make this facility a reality. I have never been more impressed and thankful for the Salvation Army. Major Bell, thank you, and why don't you please come and say a few words to us. Major Bell.
Thank you so much, Mayor, and thank you for this opportunity. The Salvation Army, each and every day, 365 days a year, is in the business of serving those who are at their greatest time of need. And we all find ourselves at that point right now, do we not? And so the Salvation Army is very honored just to be able to step up and to be able to serve our neighbors, to be able to serve those men, women, boys, and girls. I'm proud to say that since our stay-at-home order, we've been able to serve over 70,000 hot meals to the most vulnerable populations right here in the city of Houston. We've been able to give over 30,000 bed nights to those experiencing homelessness, and that very much includes the Fondy Center right here. We've been able to distribute to over 14,000 people through our distribution centers all across the city of Houston, as well as be able to hand out a little over 30,000 masks for those that are experiencing homelessness and all throughout the city. Let me just say this, though, that the Salvation Army is here to meet need, and we couldn't do it on our own. And we don't want to do it on our own. We are so proud to be linking arms with the city, the city of Houston, to be able to do this, because once again, the city of Houston, we are Houston strong. We are a resilient city, are we not? And so with that, we're seeing people that need to be sheltered becoming permanently housed. And that's the important piece of this, is that while this might be a time of disaster, a time of pandemic, we're seeing it as an opportunity to take it even a step further and to get people permanently housed. The Salvation Army can't do this by ourselves, though. And so, as I said, we're so grateful to the city of Houston. We're so grateful to the Coalition for Homelessness. We're so grateful for other agencies like the Beacon or the Healthcare for the Homeless, because the reality is we couldn't do this on our own. We're also so grateful for the faith-based community. As we have Lighthouse Church that's here. They've been a wonderful partner of ours, and they continue to be. And the reality is it takes all of us linking arms to make sure that everyone is taken care of. And so the Salvation Army, we play a role in that. And the reality is we just desire to continue to link arms with the city, with other agencies, with other churches, just to make sure that the most vulnerable are taken care of. Thank you again, Mayor, for this opportunity. God bless you.
Thank you so very much. Look, with the capacity for 150 individuals, we are currently working with other shelters to continue continue transferring residents to this ancillary shelter operated by the Salvation Army with oversight and support provided by the Coalition for the Homeless. And this facility is actually saving lives. And lastly, as services have been modified due to COVID-19, community volunteers and local agencies have stepped up to ensure those on the streets have access to food. One such organization is the Beacon, as Major Bell referred to. Normally, the Beacon is the front door into our homeless housing system, providing showers, laundry services, and meals for nearly 250 individuals daily. During this crisis, they are now serving close to 500. While most agencies are doing their all just to maintain their core services, the Beacon, with only a skeleton crew, expanded their efforts and are filling a major void. The Beacon CEO, Becky Landers, is here, and I want to express the city's gratitude to her and all at the Beacon for support for the work they are doing. Please give it up to Becky. Don't you want to come and say something, Becky? Please. Want to thank you all for what y'all are doing. Thank you.
Thank you. Thank you so much, Mayor Turner. We are thrilled to be able to do our part at the Beacon, and as the mayor mentioned, while we were serving 250 to 300 people a day, 5 days a week, we've extended that to 7 days a week. And we know that we should and we can, so we need to take on to help serve those folks that are unsheltered. And we appreciate your acknowledgement, Mayor. Thank you so much.
Thank you, Becky. The second prong of the emergency response of our strategy answers the question, how does a homeless individual get tested if they are symptomatic? The city and county have launched an innovative homeless testing program to ensure that all homeless individuals have access to testing. Homeless agencies, shelters, outreach teams, and even homeless individuals themselves can call a designated homeless testing hotline where they are quickly assessed with transportation provided by specialized yellow cabs through a partnership with Metro to the homeless testing site operated by Healthcare for the Homeless Houston. There are not many organizations that are saying, send me individuals who are potentially infected by COVID-19. Healthcare for the Homeless Houston is one of those rare special organizations. And Houston has worked overtime to keep its normal clinic doors open while at the same time expanding its services through this vital testing program. Healthcare for the Homeless Houston President and CEO Frances Isabel is here, and I want to thank her, the organization's board, and staff for their leadership and their service. Frances Isabel. Frances, come on.
Thank you, Mayor. It's actually been our honor to do this work. Although I feel a little bit chagrined that I'm the one that's standing up here rather than our staff. Our staff are the ones that are putting their life on the line every time they test somebody. And so my thanks go to the staff and to the city for all that you're doing.
Thank you so very much. The third and final prong is recovery. Until test results come back, or in the case a homeless individual is positive, they need a place to stay and medically to recover. The last thing we want is for a person to return to the streets or the shelters and potentially infect others. Therefore, we have worked to create a joint city and county quarantine and isolation facility, providing shelter, food, and medical care to enable individuals without a home to self-quarantine and isolate as needed. Individuals are referred through the homeless testing program or directly from hospitals. The facility has the capacity for 126 individuals with the ability to expand to an additional 60 rooms if needed. The items in this three-pronged action plan are already operating right now, and this is just the beginning for our homeless. Like all underserved communities, they are not forgotten and remain a top personal priority for myself and the city. And to help bring all of these efforts to fruition, we have really depended on the Coalition for the Homeless who has helped us plan, mobilize, and coordinate the 100 local agency that makes up our region's homeless response system during this time of need. And I would like to call upon their president and CEO, Mike Nichols, to say a couple of words on behalf of our homeless system. Mike?
Thank you, Mayor. My name is Mike Nichols, and I'm the president and CEO of the Coalition for the Homeless for Houston, Harris County, and Montgomery County, and Fort Bend County. The coalition, as the mayor said, is the leader of the Way Home, the homeless response system in these counties. And Mayor, I can't go any further without thanking you for your leadership. Frances is right when she says it's the employees out there who are doing the work who we need to thank, but we also need to thank the leadership, starting with the mayor and the city council and the leaders here from the Beacon, Becky Landis, Zach Bell from the Salvation Army, Francis Isbell. And the reason is because when we called them, there were lots of folks who could say no. But what they said was yes and. And that's why this is set up. That's why there is this respite facility. And that's why when this is over and COVID moves forward, we're going to be housing more people, not less. Again, Mayor, thank you. You are the leader, and your attention to the most vulnerable population is clear, and we're here to put this in action. Throughout the pandemic, the coalition has been working with our partners to ensure that ongoing homeless services are able to stay operational and to stand up these additional services for people experiencing homelessness. The coalition, thanks to the city and other partners, has distributed thousands of pieces of equipment and supplies to our partners, and we have shared guidance about direct service programs on how they can remain open while also mitigating the spread of the disease. And we have helped stand up access to testing and care for this vulnerable population, again, with the folks in this room providing this leadership. Our partners are doing tremendous work. For about 2 months now, they have been on the job 24/7 to help us keep in touch with our most vulnerable citizens. I wish I had the time to tell you all of the work of our 100-plus partners. It's amazing, story after story after story. Outreach teams like the Downtown Management District, Harris Center PATH, the Harris County Sheriff's Office, Houston Police Department, Search, and the Star of Hope are continuing to engage daily with people living unsheltered. They are sharing information about how to slow the spread of COVID-19, practice social distancing, access food and other basic needs, and to help them maintain their connection to services. Outreach teams have also provided hand sanitizers, as the mayor said, and informational sheets to people living unsheltered. Nonprofit agencies like the Beacon, as well as many, many volunteer groups, are providing more than 1,500 meals per day to people experiencing homelessness. Our permanent housing and emergency shelter providers continue to operate so people can have a safe place indoors during this pandemic. And the coalitions work with partners like the Salvation Army to stand up the shelters like the one we're standing in now. And we are now, and so that now our emergency shelters can practice appropriate social distancing and prevent the spread of disease. Again, before I turn this back to the mayor, I want to thank the folks in this room for the leadership and for the hope that when COVID-19's ended, we will move forward to have people housed in supportive housing. Thank you, Mayor.
Thank you. Thanks, Mike. Appreciate everything that you are doing and the network that we have, and the person that I follow on this initiative in this area and take my instructions from, Mark Eichenbaum. Mark, why don't you come,
Thank you, Mayor. Mayor, I want to thank you for really being a champion of all underserved communities in the city of Houston, especially the homeless community. When we look at homelessness, the impact on the homeless community by COVID-19 is kind of like a tsunami that has not hit landfall yet. The wave is cresting right now. There's hundreds of homeless Houstonians that have not been housed in the past 2 months because we've been focusing on the emergency response to COVID. Additionally, there's tens of thousands of Houstonians that are teetering on housing instability, and the virus will push them over into becoming homelessness. The true impact of COVID-19 on homelessness will not be felt today, it will not be felt tomorrow, it will be felt in the months and years to come. And that's why it's really important, and that we're very thankful that the mayor is just not dedicated to the emergency response, but the long-term response. And that's why I am personally thankful that during the mayor's tenure as mayor, more than 7,000 homeless individuals have been permanently housed with wraparound services. Those are 7,000 less individuals that would otherwise be on our streets or in our shelters today that we would have to be responding to during this emergency time. But thankfully they are housed and they are safe and they are able to social distance and they are having their basic needs met, and they're not part of our emergency response because they've been helped. The organizations that have been recognized today represent the 100 organizations that are out there and all the community volunteers that are dedicating their lives, literally risking their lives, whether it's the medical team, the outreach teams, or the shelter staff, to make sure that all Houstonians are protected and safe during this pandemic. Once again, thank you to them, thank you to their staffs, and especially thank you to our mayor and our city council members for your support.
And lastly, I want to thank Coca-Cola Southwest Beverages and the Coca-Cola AHA brand team for donating 48,000, oh, that means a heart? Well, I knew that. I was just wanting to see if everybody was going to catch me on it. 48,000 cans of water to support our homeless and other undeserved communities. Coca-Cola Southwest Beverage continues answering the call for beverage donations wherever possible. To date, they have donated beverages to support community organizations, food banks, frontline responders, and now homeless shelters and feeding programs. Also, Coca-Cola Southwest Beverages provided much-needed logistics and supply chain support to help nonprofit TXRX Labs, who are producing face shields to protect frontline healthcare workers. The Coca-Cola Foundation has awarded $168,000 in grants to Houston nonprofit organizations working on the front lines in response to COVID-19 pandemic. And again, I want to thank Coca-Cola Southwest Beverages for their steadfast support wherever a crisis affects our community. And I know he's not here, but I do want to acknowledge Andy Eakin, Chief Economic Development Officer, who also played a key role in the setup of this homeless shelter right here at Fund D. Having said that, I think that covers a lot, and now I'll pause and take whatever questions anyone may have. Did we get everything? Yes, sir.
How much testing has been done within the local homeless population?
Who wants to take that question?
Well, it's hard to say because the homeless are getting tested through various community clinics, through the city's testing program, and not being classified as homeless, and then through the homeless testing program. Through the city's specific homeless testing program, the numbers are pretty low. Although outreach teams have been spreading the word to the close to 1,900 homeless individuals that are residing on our streets, as well as spreading the word to the more than 2,000 individuals living in our shelters, we're not coming across lots of individuals who are currently right now symptomatic and in need of testing. However, cities like Boston and Seattle have found that likewise, a lot of the homeless were not getting tested, maybe because they didn't want to get tested or they didn't think they needed to get tested. And so, but they still found that up to over 30% of those living in shelters were asymptomatic positive. And so that's one reason right now that we're working with Healthcare for the Homeless Houston and a bevy of other organizations on really expanding the testing and taking it directly to where the folks live, on the streets and in the shelters, to do large-scale sample testing, so we'll have a better knowledge of the true impact of COVID-19 on the homeless population. But we are thankful because it's places like this and all the other activities the mayor was talking about, which right now seems to be working and mitigating the impact of COVID-19 on the homeless. We're not out of the clear yet. We never know what tomorrow is going to show. But right now, the steps we're taking right now, the steps the mayor is taking, are working.
Yes, sir.
Where's the city in its efforts to open a testing site on the East End?
We opened a testing site on the East End yesterday at Barnett Stadium on the East End. So that site is now open, and it's being coordinated by UMMC, United Memorial Medical Center, in collaboration with the City of Houston. But that opened yesterday at Barnett Stadium.
With local economies reopening in phases, what's the city's plan moving forward to handle a potential surge or spike in cases?
Well, you know, it's my hope that with the state starting to open more so on May the 1st, that we won't see a spike. That's my hope. But as I will tell you, is that the virus is still here. It's still in the city of Houston. We're still announcing almost every day new cases, and we are announcing almost every day people who have died from COVID-19. And so people need to take things very seriously and need to move very cautiously. So quite frankly, the social distancing is still very important. Wearing facial coverings is very important. And we're not in the clear yet. So I don't want anyone to assume that just because the conversation is about opening up, that this virus is out of here. For myself, for example, I'm going to be very, very careful, continue to do what I've been doing. The City of Houston, in terms of its programs, let me just say this. In terms of the way the city has been operating in the month of April, the city will continue to operate this way in the month of May. So all programs, all events produced, permitted, sponsored by the City of Houston will continue to be placed on hold until the end of May. With respect to how employees are functioning, working remotely, all of that will remain the same. You know, for myself, I'm not quite comfortable yet with changing things, so we're going to stay the course. We recognize that some businesses are starting to open, but I would simply say to people, if you don't feel comfortable, then you don't necessarily have to go to certain places. Just because something is open doesn't mean you have to step in. So, you know, just be careful and exercise good judgment.
Now, there's some businesses like movie theaters that don't have product because there's been no movies in production and editing and things like that. Have you heard from any business owners that may not be ready to open because they don't have product or have problem getting product in?
I've heard of some businesses who say that they will not open up on May 1st simply because they're just exercising their own judgment. I mean, I think the governor put it best. You know, just because he's saying things are open doesn't necessarily mean you have to. I mean, that's a judgment that people have to make. We all want to get back. We all want to get back to some sense of normalcy. But I think it's very important that we just do it in a very judicious fashion. Look, our numbers are and I hate to say as good as they are, because you don't want to have anybody test positively and you don't want anybody to die. But when you take a look at New York City, New Orleans, Seattle, these other places, then look at the city of Houston, as Dr. First said, we are the 4th largest city in the United States, the most diverse in the United States. And at the same time, the number of deaths that we have reported as of today is 50. That's relatively low. But it's like that because we acted in concert. You know, we were very careful. We did close things early. And that has paid off. That has reaped dividends. But until we engage in a lot more testing, contact tracing, you really don't know where this virus is. And those are just the realities. You just don't know. So it's kind of hard to tell people, to just go about your business when you don't quite know where it is. And I think we just have to be very cautious and careful as we move forward.
KHOU, with the stay-home order expiring Thursday night, will the city be reopening playgrounds, golf courses, et cetera?
Well, for the activities and functions that are controlled, permitted, produced by the City of Houston, we will continue to hold on those events through the month of May. For example, there will be no parades in the City of Houston that's produced and sanctioned by the City of Houston. So there will be no parades. Just like, for example, the Family Fun event, the Family Day that I normally have in April that we postponed to May. That event is not going to take place in the month of May. With respect to, for example, the Houston Public Library, that will continue to be closed through the month of May. So from a city's perspective, our employees, those who are working remotely, for example, the services that we are providing online, the operations will continue to operate in that fashion through the month of May. So that's for the city's operation. With respect to the golf course, I don't think the city's golf course, I don't think they're open right now. No, they are closed, and they will continue to be closed in the month of May. So from the city's activities, things that we sponsor, produce, responsible for, I am not changing that, okay? And, I guess that's as succinct as I can put it. I don't know what the virus is. I do know that our numbers are looking pretty good, and I want them to continue to look good. And so we're just going to move carefully. And I hope as things open up, I hope people will abide, for example, by the 25% occupancy. Restaurants, retailers. I hope that they will abide by the 25% occupancy. And I hope people won't just rush out to bombard these places, even though, you may be able to attend. But, just have to exercise good judgment in whatever you do.
Houston Chronicle. The governor said yesterday that churches can now expand their in-person services. Do you think that Houston area churches should proceed in reopening this weekend and having in-person worship services?
Well, I think he said that, but there are certain conditions that he also suggested that people follow. I think he still said, if I'm not mistaken, the CDC guidelines, and I think if you look at the booklet that he put out, even as it relates to faith-based organizations, it was not sitting next to one another and having some space, engaging in social distancing. I think he encouraged, for example, people who are 65 years and older to exercise judgment, and especially if you have underlying medical conditions. Look, I've always said, even as it relates to faith-based organizations, and quite frankly, any institution, people will exercise their good judgment and their common sense. I can't just tell you what not to do. Okay, let me just say, for me, and very seldom do I miss church, and I think you can pray from wherever you are. So people have to exercise their judgment. I'm not going to try to dictate every single thing that people do. Okay. All right. Any other questions? Okay. Thank you all so very much. Thank you all. They're trying to put something before council next week.